The vast majority of people in this state want to keep themselves safe.
At the outset of the pandemic, Governor J.B. Pritzker faced a problem: how to make a complex and complicated subject understandable to the general public and use that understandable data to guide his decisions. Among other key numbers like deaths, hospitalizations, and tests, the positivity rate emerged as a key guidepost to measure the spread of the novel coronavirus.
You can't make a judgment about how widespread the transmission is occurring, whether there's truly mass community spread, unless you're looking at positivity rates.
His decisions are also guided by models done by research experts showing when we might see spikes. One was developed by University of Chicago scientist Sarah Kobe, who appeared on WGN in April.
She's with the University of Chicago's Department of Ecology and Evolution, and she's one of those people that does these models that we keep talking about.
Kobe was not available for an interview today, but she recently questioned the governor's reliance on the positivity rate. She was quoted in the Belleville News-Democrat saying, quote, "I have been very critical of the use of this metric and basically almost all of the metrics they've proposed so far because they are not scientifically founded. They're roughly right, but they're not metrics you'd want to hang your hat on."
I read that article too.
Dr. Emily Landon praised Kobe as a world-class scientist, but said the governor makes his decisions based on a variety of information.
In a pandemic, no one has the monopoly on expertise.
The positivity rate shows the percentage of people tested who actually have COVID-19. It's not a broad reading of the entire population. Republican lawmakers are asking the governor to be more transparent about the data he's using.
We are concerned about the data behind them and driving them, and the fact that the governor continues to go it alone in his approach to this pandemic.
But the positivity rate is one of the few real-time indicators available to elected officials.
We want to make sure that we're measuring not just the number of people who are getting the virus, but how fast is it moving.
And the governor says all of the data used to make the mitigation decisions is available to the public through his office and the Department of Public Health.